Assalamualaikum warahmatullahi wabarakatuh. Selamat sejahtera pada semua. Untuk talk hari ini, saya buat recording sebab internet tak berapa bagus. So, I rakamkan lecture untuk hari ini. Yeah. So, for today, talk is about the client-centered and return-to-work approach for post-rehab spinal cord injury people. So, in terms of our roles with the spinal cord injury, is going to be different from others because spinal cord injury having a lot of issues and problems, especially with their impairment. As you all know, that spinal cord injury, the impairment is the loss of sensation and also muscle innervation. So they are paralyzed. Depend on the level of their injury. So our approach should be different and more focused on the priority and needs. So that's why for today I'm going to discuss on this topic. So actually, I together with my postgrad students, with Siti Nora Hamiza, together with her, we have a study with the spinal cord injury people, and the approach that we do probably people can replicate. And this is probably a good approach in terms of return to work for spinal cord injury. So when talk about client-centered approach, actually what is you all know, and just want to recall this client-centered approach. Law 1995 recognized client-centered approach, recognized the autonomy of the individual, the need for client choice in making decisions about occupational needs, the strength clients bring to a therapy encounter, the benefit of client-therapy partnership, and the need to ensure that services are accessible and fit the context in which a client lives. So, when talk about client-centered approach, we as a therapist, we recognize the decision of the client, and so actually there's a lot of benefits when talk about work together with the client, because when we work with spinal cord injury, the important thing is that the context, the environment they live with. So this is the thing that very important in terms of client-centered. So Canadian Association of Occupational Therapists, they define that client-centered approach is a collaborative and partnership approach used in enabling occupation with clients. In addition, client-centered occupational therapy was said to demonstrate respect for clients, involve client decision-making, advocate with and for client needs, and otherwise recognize client experience and knowledge. So this is the thing that we have to respect the clients and the client decision, and we advocate them. So as a therapist, before client decide, we need to advise them. We need to advise them what are the effect of their decision, So together, we work together with them in terms of on the client-centered approach, in terms of making decisions. Guidance occupational therapy 2002, they say that client-centered approach can be defined as individualized, group, and organization level approach that enable clients to participate as decision-making partners in their therapy. So they enhance their approach by together with a group and organization level. So whatever decision made must together with the group and organization. So they enhance their approach by involved with group and also organization. And in 2007, Canadian Association of Occupational Therapy, they devised their client center is that enablement as a collaboration between therapist and client. The therapist employs the enablement skills and use of occupation with the help from people who might establish good health, well-being, and justice for the client. So when we collaborate with the client, uh, we as a therapist, we must have uh, enablement skills, used for occupation. So we must have a skill to work with our client. Right? So our skill probably there is a model in terms of OT enablement skills. Right? I will discuss later. So this is the thing that talking about client-centered approach. So one of the things that involved with your client and involved with and collaborate with the group and organization, and also you OT himself or herself must have a skill, enablement skill to to uh, to have a client-centered approach. Okay, so this is very important. I did a research that when come to the spinal cord injury, uh, the things which is very important is that the when we use the client-centered approach in terms of rehabilitation, they are able to improve their functional outcome. And then when you work, you collaborate and decide anything with the family and members, the client and family members, it will increase their motivation, client motivation, and increase satisfaction. Eh? So this study have been done when we use client-centered approach. So when talk about spinal cord injury, they have the problem that experienced by spinal cord injury is varies. It can be body structures and function, and can be psychological, and also their activity and participation will be limited and restricted. So in terms of body structure and function, it can be a problem of bowel and bladder dysfunction. That can be they will have pressure sores. They will to be they will having a spasm, respiratory problem, and also sure they're going to have sexual function, and pain and body appearance, and they have a limited range of motion. It depends on the level of the injury, and they easily get fatigue, and some of them has a problem of muscle tone. They have a spasm. So all these body structure and function will be affected. And also in terms of psychological, because of their impairment, which is very serious, affect their appearance, their functions, their, and then they will suffer depression, anxiety, and low self-esteem and poor self-concept. So this is the thing that they're facing when they suffer this spinal cord injury. And then there will also have problem of activities of daily living. They and also leisures because of their, and because the impairment, they have problem of having their leisures before, and they have problem of home maintenance, vocational, and education. So all these things will be affected when they experience uh, their injuries. So as an OT, we should recognize all these things, and we should understand and work together with the client. So the process of their psychological also you need to understand. And at the beginning of the injury, probably they have a denial, and it takes time to accept their disability. eh. So when talk about the needs of spinal cord injury people, there's a lot of studies. There are a lot of studies. They need so this is the thing that we as an OT we should do with this spinal cord injury. For example, mobility. Eh? So you need to train them in terms of mobilize themselves at the beginning. For example, transfer from wheelchair to bed, and from wheelchair to car, and also how to handle their wheelchair. Yeah. If there is the level is quite high, it's going to be a problem in terms of handling the wheelchair. Even if they want to push at certain ramp at certain ratio, they have a problem. So as an OT, you need to train in terms of their mobility, in terms of their transferring, in terms of maneuvering wheelchair, in terms of public transportation. So for people who have been using wheelchair, they have problem in terms of public transportation. So some of them, that's why in terms of mobility, some of them need their own transport. They need to have a license for car. And then you also need to train them in terms of activity of daily living, in terms of using, taking baths, shower, in terms of mobilize uh, their wheelchair in home, at work. So in terms of dressing and etc. So all these things need to be trained to them. And in terms of social integration and consultation, sure, they have a social integration problem. And so you need to uh, motivate them to socialize. Then you sometimes you need to introduce them to this group which is have a similar uh, condition, because when they were together with the group, they are more they are more uh, successful rather than work individual. So we need to introduce them. For example, like uh, group members who having a similar impairment or problem, and then with their own group, they have activities, for example, sports, leisure, and etc. And you have to do home modification. Sure, some of them have issue of problem of modification at home. So you need to suggest them, recommend them, advise them in terms of modification needed. And for example, so for example, like in our our home, old home, our typical Malay home, there is for example, like their kitchens at the lower floor. So it's going to be a problem for them. Physical accessibility also need to do with them. So some of the building, for example, like shopping complex, they have problem of accessibility. So you need to find to explore the ways of them for them to access, eh? And then they need some additive equipment. For example, like they need glove, adhesive glove for men wearing their wheelchair. Some of them, if they have a high level, for example, like C6, they need to have utensil, which is a strapping in within their hands. So you need to come up with, for example, like C7, they have problem of typing. Don't have any. They're unable to uh, extend their fingers. So you need to do some additive equipment. Their psychological health, and their sexual and reproductive health, and some of them unable to to have a normal sex. So what are you going to do with them? How are you going to advise them? So you need to have a really good skills in terms of handling them. So when you are able to address all these things, clients become motivated and satisfied. Clients have better health, and clients can participate more in purposeful and meaningful activities. And clients have good of life, good quality of life. Quality of life if you are able to address all these things. So there's a lot of studies in terms of client-centered approach. This from Pilot 2004. So they use qualitative design together with 30 healthcare professionals, including OTs and 20 patients with spinal cord injuries. Uh, so so they found that uh, the study said that um, they involve with the client in terms of making decision. But when we go through the study, uh, the concept do not involve full patient participation during the decision making process. So it's not really actually a client-centered approach, even though they they say that they involve the spinal cord injury with 20 patients, right? and Spurun et al. 2011. There is a study. This is qualitative design also. So this is the author developed TalkQuest module based on client-centered and task-oriented approach, which consists of 5 steps. This is involve extracting individual goal, defining individual goal, task analysis, composition of training program, and evaluation process, with the aims to improve specific and generic arm hand skill performance (AHSP). So the limitation is that the module seems to emphasize more on the problem related with upper extremities, and activities in improving extremities skill performance, such as cutting food, soft cake, using knife and fork. So it's not really a client-centered approach, but only activities to improve their upper extremity skills. Yeah. So this is then Spurun et al. 2011 also. To determine the effectiveness of TalkQuest, they study the effectiveness of using TalkQuest, and then result shows that TalkQuest module improves specific using COPM and GAS and generic using VLT, short form AHSP for a person with spinal cord injury in both active rehab. However, there is no significant difference. So they didn't found significant differences between control and TalkQuest group. So when talk about so we come up with the study, we call it occupationally based intervention program. Right? So we use occupationally based intervention program using theoretical framework of MOHO and Canadian model of client-centered enablement, CMC. And one important thing that we want to have a client-centered approach, we use occupational self-assessment. They call it OSA. This is developed by model of Gary. Model is using model of human occupation, where occupational self-assessment is the way to understand the client needs and their priorities and their needs. So then we come up with a program which is individual, educational, home visit, and follow-up session. So this is the study that we been done for occupational based intervention program. So as you all know that when talk about model of human occupation, we looking at their personal and also their environment, and together with their personal environment, uh, we try to improve their performance and participation. So, as you all know, that personal involve the volition, habituation, and performance capacity, and the environment involve physical, social, and together with these things, we want to improve their performance and participation. So, this is Canadian model centered client-centered enablement. This is from Canada model. As a OT, as a professional OT, we need when we work with the client, we need to adapt and advocate, coach, and collaborate, and consult, coordinate, design, educate, and engage. And we must be specialized in what we do. So this is we call it Canadian model of client-centered development. So, and you must remember as an OT, not only you're going to consult, but also you have to coach them. You need to collaborate with them. You need to adapt their needs and their priorities. You need to engage them. You need to be specialized. This is very good for OT when talk about client-centered approach. They're using this Canadian using this client-centered enablement. So when we work together with client, remember all these skill. They call it skill enablement. You need to have a skill in terms of together working with the client. So the occupational self-assessment is a process. Is a process where we want to identify. The client will identify uh, what are the problem they're going to have more their problem, and then the next step is that eh, uh, to identify what are the things which is it important for them, and then the step three, they're going to choose which one they want to change. eh. So this is called occupational self assessment. But remember that when you want to do with your client is understand what you're going to do. There's no issue of cognitive problem like spinal cord injury. There'll be no problem in terms of their thinking inside or that. And this is the way. There is, if I'm not mistaken, there is 21 items. 21 items that this occupational assessment have been developed, and there is a testing of the reliability and validity. The first thing is that step one, they will they have uh, there is a questions. The question domain involve of volition, habituation, and also performance. So the question step one, they're going to identify which one they're going to have, which item they're going to have a problem, whether then the step two, whether this item important to them, which one is important, which one is not important, and then step three, they're going to choose up to 4 things they want to change. So if you give this question to them, ask them to read, understand, and then you explain to them, then after that, you're able to identify which is the thing that they want to change, like to change with which one is their priority and their needs, their needs and their priority. This is the continue. For example, getting done what I need to do, having a satisfied routine, handling my responsibility. So this is the thing that they're going to identify, and then they're going to choose the 3 things that is they like to change, and then as an OT, we easily can grab what they want actually. So Uh, this more on environment. This the first this one more on performance. Yeah, this one more on performance, and this one more on the environment. So when we come out with uh, the when we come out with the case of 12 spinal cord injury people, so we found that the most they have the priority, which is the most important one. This one, the red color one, getting where I need to go. So they have problem of in terms of mobility, transportation. They want to go. They getting where I need to go. This is uh, the most important thing they want to do. And then this one, the basic thing I need to live and take care of myself. The basic things I need to live and take care of their self. This is the the most uh, and then this accomplish what I said to do. This is the priority one. The most priority one is this one. Priority two is this. The basic things I need to live and take care of myself. Then the third priority, this one. Get where I need to go, and also the basic thing I need to live and take care of. So you already knows in your group what they need. Getting where I need to go, accomplish what I set out to do, and also the basic thing I need to live and take care of myself. So from this we come up with a program. So explanation in terms of the priority 1, 2, 3, in terms of their position, affected what they want to do. Participants claim that they have a plan to work but did not know what are the stable job and convenient environment with their current condition as wheelchair user. So this is the explanation when talk about actually they have planned to go to work, but they did not know what are the stable job and convenient environment. So as an OT, you need to explore. You need to come up with a stable job for them, and the environment. You need to assess. So when you want to place them to work, you need as an OT, you need uh, uh, to assess whether the job stable for them, and then is that convenient or the environment is accessible to them. In terms of environment, the basic thing they need to live and take care of themselves. So the explanation is that participants claim that they require things related for survival and health, such as adaptive assistive equipment and orthosis. So they need adaptive assistive equipment for them to survive. So as an OT, you need to assess their basic needs, and then you need to adapt assistive equipment for them. Then the third one, in terms of performance, the mobility. Participants claim that they have difficulty in using public transport for driving to the shopping complex, recreation places, hospital, or anywhere they wanted to go. So this is talk about mobility. They have problem in terms of using public transport and driving to the shopping complex. So as an OT, we need to looking at this matter in terms of the transportation. Okay. This is the case that we work with. They call it Mr. Ash. Mr. Ash. Um, he's a C67 due to the motor vehicle accident, and uh, he's a single, 39 years old. So this is the thing that they have a problem, right? With 6, 7, and 6, 6. This is the impairment they're facing with. So with session one, with the individual session, our objective is to solve the needs and priorities related to the basic tasks of living, managing life and relationship, enjoyment and actualization of client through one-to-one session. So we do individual session. Uh, so with this individual session, the first thing we identify their three needs and priority in life. Then therapy work together with the client in solving the needs and priorities in the following individual session. So a discussion between uh, occupational intervention of the therapy team was being done, particularly to determine the best solution for every needs and priorities. So we do individual session with them to work together with the client, uh, together with the to solve their needs and priorities. For example, like Mr. Ash, they were then his need is to to have a adaptive device. You see that the problem of Mr. Ash is to feed himself, to feed himself. So we what we do is that we modify, we put the non-slip material at his plate, and then and then we have an adhesive utensil strapping at the punya hands, and then for writing we use this modification strapping for him to write, and then for cutting nails also we have problem. For take shower also they have problem, so they use this sponge and for him to do bathing, and also this is the individual session together with him. We want to understand their needs and practice. So we did all these things to him. And then the problem of this fella, the Mr. Ash, a problem of performing his keyboard typing, and transfer from wheelchair. So we modified. So we teach them in terms of transferring. So we use. He also have problem of mobility, transferring from wheelchair to car. So we use a slide board to training them to transfer, and then we had this for Mr. Hash. I have a problem in terms of typing using the keyboard. So we they have problem of doing extension. He have problem of straighten his fingers. So we do modification using spleen to strengthen the fingers of Mr. H. So I will show you the video. Session 2. So we have education session. The objective is to solve the needs and priorities related to basic tasks of living, managing life and relationship. Also satisfaction, enjoyment and actualization of client by educating and the discussion among OBI team, OBI Occupational Based Intervention Team. The session involved theory and practical part, medium of delivery during the session included. So this is the topic that we covered in the education session. Introduction to spinal cord injury, the impairment, introduction to OT therapy, how to manage time, work simplification, adaptation to necessity device, stress management, preparation for job, sexuality among spinal injury people, support for spinal injury people, sharing experience with other person who suffered from spinal injury become success, job opportunity, home dimension for wheelchair user, adaptation in driving aspect. So all these things, we do it at education session. Home visit, this is the very important thing that we did in, with this approach, that we identify barriers client home environment which have been restricted client performance and participation in daily life. So we adapt also and modify client home environment by designing home layout based on client condition. And then to collaborate with other specialists, people in reducing, eliminating the barriers at the client's home by getting any sort of help. So this is role as an OT, not only identify the barriers, but we design and adapt to the client environment. And then we collaborate with others like ADUN for involvement together with with the patients. So the session conducted for clients who have been problem with their home environment. So together we go visit the environment and then we design home layout, which is suitable with the client condition and collaborate with others. This is the example of the home environment. So we identify the problem, the issue, and then we suggest for modification. And then so this is the thing we identify and we recommend for modification and etc. This is the example at the home environment. You see that there is a ramp. How are they going to mobilize the wheelchair if there is not a ramp, there is a stairs to access to their house. So they limited their mobility. So we need to suggest a ramp for them to access to their house. This is the example of the toilet room. So the problem is within our our typical home, Malay, especially Malay, is there is the level. There is a different level with the kitchen room, toilet. So it's going to be difficult for them to mobilize themselves. See, there is a stair to go to the visitors' room, ruang tamu. So we need to identify their mobility problem and then suggest for suitable ramp for them. This is their needs within the toilet, toilet room. This is the example at their workplace. So, so we suggest for modification. If you can read in detail, the problem is to assess. Then we suggest the 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 ratio of the RAM. This is too steep for them. So we use this two-step RAM. The important that the ratio is 1:15. The 1:15, and if the ratio is more than that, for example, 1:7 or that, they cannot mobilize themselves, especially who having a high level of injury of their spinal cord. This is an example you can read. This is the stairs that they're going to access at their home, and it's very difficult for them to access. So this is the home education. So we involve together with the YB, and also SOCSO. So as an OT, we have to write letter to them, and discuss the family members, how to do about it. So this is our role, not only advise, educate, but also to collaborate with others, in terms of client sake. So at session 4, we identify any new problem related with their needs and priorities. To identify any difficulty in doing suggested treatment during session 1, 2, and 3, and consult the suitable treatment for new problem difficulty faced by the client, to encourage and continue the suggested treatment before. So we have another session with them. This session been done through phone call only. Any new problem aroused and difficulty in doing suggested treatment was be solved by consulting the suitable treatment. In addition, client has been encouraged in continuing the suggested treatment before. There's no problem with it. A discussion between OBI's OT team was be done every time when there was a new problem, difficulty faced by each client, to determine the suitable treatment to be done. So, at session 4, it's more on follow-up. And using a phone call, we want to understand what we have suggested to them. Is there any problem? And we discuss with our team to determine the new, if there is a new problem difficulty faced by the client. This is the example. We teach them to transfer. This is C766, problem of transferring. So one of the needs of them is to perform transferring technique. So you have to be careful. You have to be careful, and because we have a problem of balance. In terms of training with them, you have to be to be very to have a safety precaution, in terms of them to perform. You have to be there. So safety is very important, when you train with them. These are the basic things that we did with them. Okay. is unavailable, I will access through the file. Cannot play pula, ya. Okay, never mind. Uh, okay, we finish. Actually, we finished. But I will show you the example of the typing video. This one is very important. Is again. Okay. Okay, I cannot show you because there is a problem of the video. I will find the video and we upload into the island. So this is the process of we did it with the spinal cord injury. So using client-centered approach and using occupational self-assessment (OSA). So by using OSA, we are able to identify the client needs and their priority. So as an OT, you can identify and you can their problem, and then you come up with sessions, different sessions to understand individually what are their problem, and then you can do different approach. For example, like uh, improve their basic needs. You modify and adapt what their needs. Then do home visit or work visit to identify the barriers, the problem they have. Eh? Then you have to have education session to their needs and their priorities. So with that, I finish my talk, and I'm sorry unable to online with you, only by recording. So thank you very much. See you all. Bye.